Hello, my name is Andrew Martin, and today we'll be going over assessment tools and processes relevant to OT workplaces.
Are assessments for psychological health and safety relevant for OTs? Well, a 2007 analysis by Stats Canada revealed that occupational therapists were ranked 7th in stress levels out of all health professionals. A recent draft report has shown that Albertan OTs score higher on depersonalization and lower on vigor as compared to others. Furthermore, analyses of OTs' experiences in general have uncovered several themes, including lack of time, resources, and personal satisfaction with their work. According to the guidelines set out by the Mental Health Commission of Canada, assessment of risk factors that cannot be eliminated is an integral step in the planning process. They state that successful identification of the issues will determine where to begin to address concerns and make improvements. The action guide indicates that the planning stage involves gathering relevant facts about the organization and then surveying employees, making sure that they're active participants in initiatives to improve psychological health and safety. Assessments are done across different levels of an organization for various purposes. Sometimes a champion within an organization will need to present assessment findings demonstrating the cost impact of psychological ill health and safety for policy development. Assessments can be used to establish baseline measures and can be used to evaluate the effectiveness of interventions. They can also be done in various ways. This can include reviewing existing records, such as performance reviews or staff meetings. Assessment surveys are useful for establishing areas of concern or areas of strength. And focus groups can be used to engage workers on a more personal level and attain a deeper understanding of survey findings. I'm going to go through a handful of assessment tools. I'll be accessing these tools from 3 major resources: the De-Stress Your Workplace Toolkit, the Guarding Minds at Work website, and the Workplace Strategies for Mental Health website. The self-assessment tool for measuring costs of work stress is done at the organizational level, and it provides an estimate of the economic impact of psychological ill health and safety. It does so by providing an Excel worksheet that factors in work stress cost indicators as identified by the evidence base. This information gathered can help spur decisions for implementation of further assessments or interventions, so it can be a good starting point for organizations. The Guarding Minds at Work organizational review worksheets are completed by the heads of organizations or units and serve to identify concerns in a workplace with each of 13 psychosocial risk factors. As seen in the example below, 5 questions are rated based on level of agreement. Based on the sum of the scores, the psychosocial factor in question will either be a serious concern, a significant one, a minimal one, or a relative strength. These worksheets also provide a list of benefits to an organization if that psychosocial factor is being met, as well as links to appropriate responses if a concern is identified. The Guarding Minds at Work initial scan is completed by workers. It gets a quick snapshot of employee perception on their work environment. As seen here, 6 statements about psychosocial factors in the workplace are rated based on level of agreement. This is a good tool to implement if your workplace doesn't have the time or resources to have employees complete a more comprehensive survey, or if your organization has just conducted a survey that didn't address mental health. You could use this as an add-on. The Guarding Minds at Work survey is a more comprehensive assessment of employee perceptions. All 13 psychosocial factors are assessed within 68 questions. A graph such as the one seen here compiles the results, allowing you to flag any concerns and make the significant ones your top priority. It is recommended that the organizational review and the survey are both conducted to provide both employer and employee perspectives. However, the survey can be done on its own too if your workplace lacks the data to do the organizational review accurately, or if just the employee perspective is necessary. The Management Competency Indicator tool is targeted towards managers, team leads, or anyone in a leadership role. It helps them self-reflect on their own behavior and how it might add or detract to the stress that their staff experience. It covers 4 main areas, as I've listed below, and scores them as an area that is effective, reasonable, or a developmental need. The tool offers some suggestions on how to improve effectiveness in that area. Management behavior is often a source of work-related stress, so this self-assessment tool might be a good way for those in leadership to check up on their own performance. The Workplace Strategies for Mental Health website offers some self-assessment tools that help any worker reflect on how they are doing at the moment. This can help guide whether further assessments, such as doctor's appointments, might be necessary. The tools here cover a variety of aspects of well-being, including work-life balance, signs of mood disorders, and general mental fitness. These are useful in that they can be done at any time, they're quick, free, and provide personal results. It's important to keep in mind that both the organization and the individual are responsible for workers' psychological health and safety.